Very good morning, everybody. So, we will be continuing with the topic called fluorides in dentistry. Over the last two classes, we have discussed about the basic introduction to fluorides, the historical evolution of fluorides in relation to dentistry, as well as the toxicity, the fluoride toxicity, which can be classified as acute fluoride toxicity and chronic fluoride toxicity. Also, how fluoride is metabolized in the body, and finally, what are the mechanisms of action of fluoride in relation to caries prevention. So today we'll be starting another topic in relation to fluorides. This is a continuation of fluoride toxicity, and the topic for today is defluoridation of drinking water. So I told you the most common reason for your fluoride toxicity, be it dental fluorosis or skeletal fluorosis, is due to excessive presence of fluoride in drinking water, naturally occurring fluoride in drinking water, which is a major cause of concern, and hence we need to know how to reduce the incidence of fluorosis or how to prevent fluorosis that is associated with increased water fluoride concentration. So fluorosis is considered as an endemic disease. An endemic disease is a disease which is constantly present in a given geographical area. So because the source of fluoride here is drinking water, these are all geographically distributed. So there are various endemic areas across the globe where fluorosis is present, and hence in such places, to reduce the fluoride concentration, we need to think about methods of reducing the fluoride concentration in drinking water, and that is what is known as defluoridation. Defluoridation of drinking water is another major question for you in your university examinations. So first, coming to the definition of defluoridation, it is also a very important definition. The downward adjustment of fluoride ion concentration in public drinking water supply to a normal physiological concentration of 1 ppm for preventing caries with a minimum chance of causing dental fluorosis. So we have been talking about fluoride as a double-edged sword. So here the definition is, it is basically the downward adjustment of fluoride ion concentration. So when you have the public drinking water supply, when you reduce the fluoride concentration, and you do not completely eliminate it, because you all know fluoride is also beneficial. That is what we have been discussing in the last class regarding mechanism of action of fluorides in caries prevention. So it is seen that when the fluoride concentration is 1 parts per million, it is enough for beneficial for preventing caries with a minimum chance of causing dental fluorosis. So defluoridation does not mean you are trying to completely eliminate the fluoride. Whatever fluoride is there in drinking water, you are trying to have a downward adjustment of the fluoride ion concentration to a ppm up to 1 parts per million. So with this concentration, you can expect caries inhibition, as well as at this concentration there is a very minimal chance of causing dental fluorosis, and this is known as the definition for defluoridation. So when you talk about fluorosis as an endemic disease, I repeat, endemic disease is a disease which is constantly present in a given geographical area, or more than 25 countries across the globe are affected with fluorosis, and the global prevalence comes to around 3.2%. That is 3.2% of the population throughout the world is affected with fluorosis, and it could be skeletal or dental. So combined, the prevalence is 3.2%. When you come to distribution of fluorosis in India, so this is a map this is of course the older map. Now there are new states that are formed. So according to the last survey, that is National Oral Health Survey and Fluoride Mapping, that took place in 2002. During that time, this was the political map of India, and these areas where it is shown in green, so these states like your Uttar Pradesh, Rajasthan, Gujarat, Andhra Pradesh, and Tamil Nadu, these are known as the hyper-endemic states. Hyper-endemic states is more than 50% of the districts are affected with fluorosis. So as of 2002, these are the 5 states. Of course, now we know there are other states that have been newly formed. Your Jharkhand, your Chhattisgarh, and then Uttarakhand and Telangana. So with that, the number of states changes. But of course, these are areas with hyper-endemic fluorosis. That is, more than 50% of the districts are affected with fluorosis. And among that, Rajasthan is a state which has all the districts affected with fluorosis. Okay, And when you talk about Kerala, there are fluorosis endemic areas in Kerala as well. We'll be discussing about that later on. So those which are there in violet are having less than 30 to 50%. Less than 30% of the districts affected with fluorosis. So this is the why we stress on 2002 data is the nationwide survey on the fluorosis was conducted last in the year 2002. So according to the 2002 data, 14 states and 3 union territories. So currently it has increased to 18 states because of the bifurcation of few states. So now it is 18 states and 3 union territories. The hyperendemic states include Gujarat, Rajasthan, Uttar Pradesh, Andhra Pradesh, including Telangana and Tamil Nadu. And in Rajasthan, all the 31 districts are affected with fluorosis. So when we come to the distribution of fluorosis in Kerala, there are 2 districts in Kerala where you can see fluorosis. One is Alappuzha and the second is Palakkad. These are 2 districts which have reported fluorosis in Kerala. Now coming to what are the optimum levels of fluoride in drinking water. The optimum levels according to the World Health Organization 1963, they have given a range. Though it is called as 1 ppm, there is always a range. Now why there has to be a range is water consumption is not the same throughout in all the places, because water consumption largely depends on the climatic factors. You all know in a hot climate the consumption of water is more, and in a cold climate the consumption of water is very less. So we cannot have a uniform standard value like 1 ppm because it directly reflects on the water consumption of an individual. So in places where the water consumption is more, the fluoride that can be added could be as less as 0.7 ppm because you are drinking more water. But in places where the water consumption is less, you might have to have concentrations up to 1.2 ppm. So this range is basically related to the temperature of that place. So when we discuss about systemic methods of fluoride delivery, I should also tell you the formula that is used to calculate the amount of fluoride to be added depending on the temperature of that place. So as of now, understand that there is a range. It is not just 1 ppm. It is 0.7 to 1.2 ppm. ppm refers to parts per million. So if you are dissolving 1 milligram of fluoride in 1 liter of water, it is called as 1 parts per million. Okay. So this is the range of concentration that is recommended by the World Health Organization. However, the Ministry of Health and Government of India, according to the Indian scenario, they have given a permissive limit of 1 ppm and an excessive limit of 2 ppm. And according to the Bureau of Indian Standards 1991, the allowable concentration is 1 ppm and acceptable is 1.5 ppm. So between 0.7 to 1.2 is the ideal range of recommended fluoride concentration in drinking water for preventing caries with a minimum chance of causing dental fluorosis. Next, coming to what are the ideal requisites. So we are going to start with what are the different techniques available or methods available for defluoridation. Before we move on to that, what are the ideal requisites of a defluoridation technique? So any technique should have a set of ideal criteria. It is based on these ideal criteria you decide or you list down the advantages and limitations of each technique. So the ideal requisites of defluoridation technique, obviously it has to be economical because you see a lot of population affected in India, especially when you talk about countries like India. You have a lot of population affected with fluorosis, and hence it should be affordable or economical. Second, it should be efficient. It should be consistent. Fourth, it should be simple. Readily available raw material should be used. It should be acceptable to the community. It should not alter the taste or produce odor, and it should not alter the pH of water. So water, as we all know, has a specific criteria or quality to make it palatable. So it should not affect the quality of water. It should be a very simple procedure. It should be which anybody can do it, or it should be done with a readily available raw materials. These are all the ideal requisites of an ideal defluoridation technique. Now coming to the classification. This classification for information is not given in your textbook. They have asked the classification earlier in university examinations. So just make a note of this, that the defluoridation techniques can be broadly classified into 4. One is based on adsorption process. Second is based on ion exchange process. Third is based on precipitation process. And the fourth is other or newer techniques. So this is the broad classification based on mechanism of action, that is how that agent is going to reduce fluoride content of water. So if it is based on adsorption process, it is one set of technique. You have based on ion exchange process, based on precipitation process, and you have other or newer techniques. So under each of this classification, we will be dealing with a few examples. So this is for your information. The first defluoridation was carried out in India at the National Environmental Engineering Research Institute, okay, abbreviated as NERI. So this National Environmental Engineering Research Institute is situated in Nagpur in Maharashtra, and the first defluoridation in India was carried out in the year 1961 at NERI. First, let us discuss about based on adsorption process. So adsorption process is whatever is the material, it when added to water, the fluoride gets adsorbed. There is a difference between adsorption and absorption. Absorption if it is getting into this, and adsorption if it coats the material. So here what happens is whenever you introduce a material, the fluoride from drinking water coats the material, and then that is how it removes the fluoride content from water. So based on this adsorption process, you have around 7 examples which work on this criteria. One is activated alumina, next is activated carbon, you have processed bone, you have bone char, jute, coir, magnesia. So out of them, only a few we will be discussing a bit into detail. First is activated alumina. The reason we are discussing about activated alumina is it is the method recommended by the United Nations International Children's Fund for rural India. Okay, so UNICEF recommends this material for rural India, and it is also used in another technique called as Prashanti technique. Prashanti technique gets its name because it is used in a place called Prashanti Nilayam in Andhra Pradesh. So there is a huge university there. So the whole area is endemic. So this is what is used in Prashanti Nilayam in Andhra Pradesh, and hence the technique is known as Prashanti technique. So activated alumina you should know for 2 reasons. It is recommended by UNICEF for rural India, and it is used in Prashanti technique. The second is activated carbon. It is made by heating paddy husk, coconut fiber and wood. So the basic problem with activated carbon is it makes the pH acidic and imparts a color. So as you all know, this is already black in color. It imparts an unacceptable color to drinking water and makes the pH of water acidic. That is the disadvantage of activated carbon. The third is the processed bone and bone char, that is dried and crushed animal bone, which is heated to 600 degrees Celsius for 2 hours. The main disadvantages is bone could lead to contamination. There could be transmission of some infections possible, and it is unacceptable by all the communities. However, it is used in various other countries, but this is also a method for defluoridation. The next is based on ion exchange technique. Ion exchange technique is we have 2 types here. What mechanism is going to act is if there is an ion exchange. Okay, so there is an exchange of fluoride ion by this active ingredient. You can broadly classify it as cation exchange resins and anion exchange resins. The cation exchange resins, the example, the first one that was used in India in 1961 in NERI was the Defluoron 1, which is sulfonated sawdust plus alum. When you use sulfonated coal plus alum, it is known as Defluoron 2, and carbon and magnesia. These were the few cation exchange resins that have been used for defluoridation. And the basic disadvantage of cation exchange resins is the cost and altered taste. Similarly, the anion exchange resins are polystyrene resins. They also are costly and alter the taste. So these are the few examples of anion and cation exchange resins that work on ion exchange process. So this video will wind up now. In the next video, I will continue with the precipitation process. Thank you.